folks, with fall right around the corner, we know flu season will be here before you know it. And just like last year, the Duval County Medical Society Foundation is helping to spread the word about the importance of getting vaccinated against the flu.
Flu Vax Jax is what it is called. And joining us now to talk all about it here live for this campaign, Dr. Sunil Joshi. Good morning, Doc. Thank you so much for being with us, first of all. But second of all, we know lots of folks running out and getting the COVID vaccine, whether they've got their first dose, second dose, they're fully vaccinated. Now, is there any issues with mixing doses, with getting the COVID vaccine, then going right out and getting that flu shot?
Yeah, good question, and good morning. Thanks for having me this morning. But no, at the beginning of the pandemic, when we were first getting the COVID vaccine out, we were having people wait 2 weeks after the COVID vaccine before they got the flu shot, or vice versa. We no longer think that's necessary. So if somebody's out to get their COVID booster or their first COVID vaccine today, they can also get the flu shot today as well. And so this is another way to make it a little bit more convenient for people, so you're not going back to the pharmacy 3 or 4 times just to get your vaccine series completed.
You know, we've been talking a lot about access to the COVID vaccine, but now let's talk about the flu vaccine. How do you have access to that? Because the issue is not just for folks who have insurance, right? You go to your doctor, you get the flu vaccine, but what about those who are uninsured? Where do they go, and is it free of charge?
Yeah, that's a great question. So if you have private insurance, then the flu shot is free to you. You do not have to have an out-of-pocket payment for the flu shot. Folks who don't have insurance have to pay out of pocket for it. The flu shot is not free like the COVID vaccine has been to the general population. So you're talking about paying between $35 and $55 a shot. So if you have a family of 4, you may be looking at over $200 here for the flu vaccine. And so it is important to understand that. And there are a lot of folks in our community. We have over 100,000 people in Jacksonville who are uninsured, who may not be able to afford the flu shot. And so we do offer free flu vaccine vouchers on our website, fluvaxjax.com, for those who may be interested and who don't have insurance. All you have to do is put in your name, your email, and your zip code, and we'll send out a flu vaccine voucher in an area that's close to where you live.
Fluvaxjax.com. Very important information there for folks who are in need of getting the flu shot free of charge if you don't have insurance.
And Doctor, before we let you go, kind of a 2-part question here, because we know as we went through our last year, focused heavily on COVID. The flu season wasn't so bad, at least not with reported numbers. I want to ask you why you think that is. I know there's a lot of folks skeptical out there who would say, well, flu wasn't focused on, we were just doing COVID testing, and flu was still around. I mean, do you think that is a possibility, or do you think it was just the social distancing, people being vaccinated? And with that in mind, do you think flu is going to be making a comeback this year? So I hit you with both of those questions at this point.
Yeah, so number one, I've heard a lot of people say, oh, there was no flu last year. That's just because the media wasn't talking about it. No, that's not true. There was very little flu last year because there was very little flu. And a lot of that had to do with the fact that we were socially distancing, we were wearing masks, people weren't going to large indoor events. Remember, we weren't filling up college football stadiums with fans, college campuses weren't filled with students. And so viruses like the flu were unable to spread as much as they have in previous years. In fact, there's some data to suggest that there was a 75% reduction in emergency room visits for the flu. And just for perspective, in the 2019-2020 flu season, we had roughly 200 children die from the flu. In the 2020-21 flu season in the United States, we only had 1 child die from the flu. So there was definitely a significant reduction. And I do believe that the mitigation measures that were put in place throughout the country, not just here in Northeast Florida, had a big role to play in that. Also, flu vaccine rates increased throughout the country as well last year, and that also played a significant role. Am I concerned that we're going to see the numbers go up this year? I am, because we're not doing as many mitigation strategies, of course, and which, going back towards life as normal, we're going to expect to see some of these viruses increase. But my biggest concern is that our hospitals, though they are becoming less full compared to where they were 3 or 4 weeks ago, they still have a very large number of COVID patients in there. As we start to approach the flu season, if we start to fill the hospitals up with flu patients as well, we could get right back to having a crisis like we were having a few weeks ago. So we have to be very careful. And it is one of the reasons why we want people to get vaccinated against the flu. Remember, those who receive a flu vaccine, adults, are less likely to require an ICU admission if they do get the flu. And for children, 70% less likely to require a pediatric ICU admission if they get the flu as well. So very, very important to get the flu shot to help reduce hospitalization.
Dr. Sunil Joshi, thank you for your time. You know, part of going back to normal, part of normal life is, in fact, dealing with viruses and, God forbid, being sick, but having the tools in place to fight these viruses and even mitigate beforehand is so very important. The hashtag is FluVaxJax. We've got all those resources for you online. Again, appreciate the time, Doctor. Let's get over to